Welcome to this webinar on why female athletes should know about the menstrual cycle. I'm Jen Mackey, a retired Olympic rower, and I'll be facilitating this session. We've got Dr. Megan Ogilvie and Dr. Stacey Sims to take us through what we need to know. Megan, how do we know what is normal in the development of menstruation?
Thank you, Jen. The thing is, if we don't know what's normal, then we don't know when things are not going quite right and when to go for help. And it's really important that our young female athletes have an appreciation of what is normal in terms of puberty and also what is normal in terms of menstruation. So a normal puberty will start anywhere between 8 and 12 years old, and the first sign of normal puberty is breast budding. If a young girl hasn't had breast budding by the age of 12, then she should see her general practitioner for assessment. About 2 years after that breast budding, the first period will typically occur. And if that young woman hasn't had her first period by 15, again, she should be looking for medical review from her general practitioner. Just before that first period starts, that young girl is going to go through a growth spurt. After the first period, she still has another few centimeters to grow, but she's going to do the majority of her growth prior to that first period starting. It is super important that that young athlete is fueling properly to complete that growth spurt in a healthy way. Most girls will move into a regular menstrual cycle within the first 12 months after the first period, but sometimes it can take up to 2 years, and that can be completely normal. A normal menstrual cycle is considered between 28 and 35 days, occasionally out to 45 days in adolescence, and then periods will mostly stay stable until menopause. And a normal menopause is about the age of 51. The most important point to take away here is that a normal menstrual cycle cannot be assessed on any sort of hormonal contraception. You need to stop your combined contraceptive pill, your progesterone-only pill, take out your Mirena IUD to understand what your native menstrual cycle is like.
Thanks, Megan. It's good to understand what young women should be looking out for. Stacey, what happens in our bodies to cause these changes?
Thanks, Jen. I really want to kind of highlight specifically what our female sex hormones are. So we hear a lot about estrogen and progesterone, and these are our two driving factors that cause these changes, our epigenetic changes. When we look at it, specifically what happens with the menstrual cycle is we have these different phases where these hormones go up and down. So if we talk about the follicular phase, knowing that day 1 is the first day of bleeding, and estrogen and progesterone are relatively low. So if we look on this, we see that estrogen is low, progesterone is low. And then right before day 14, we have this surge of estrogen. And this is in isolation, which is important to understand. And I'll get to that in a minute. After ovulation, we have a little dip in estrogen, and then both progesterone and estrogen start to rise. This is what we call the luteal phase. And as Megan had mentioned, that a typical menstrual cycle is anywhere from 25 to 40 days, and a textbook one is around 28 days to give a really good overview of what happens with these sex hormones. So we know that estrogen, progesterone, as well as some other hormones, are responsible for reproductive function. But we also know that estrogen and progesterone affect every cell of the body. So basically, we know that estrogen increases fluid retention. This is why we feel a little bit bloated. We know it alters carbohydrate metabolism, so the way that your body fuels itself during exercise. It changes from more of the sugar aspect to using more free fatty acids. We also know that estrogen can increase some clotting factors, which if you're traveling might be a little bit of a worry. Now, that one blip that I was showing right before ovulation of estrogen on its own, we know that estrogen by itself in isolation here, it is anabolic. So it means it builds tissue, and it works on the muscle cell at its base level to really increase muscle protein synthesis. But as progesterone starts to come up, progesterone takes over, and progesterone breaks tissue down. So knowing that estrogen in itself can repair and build tissue until progesterone starts to come up. We also know that estrogen is very essential in bone formation. And we also know that it decreases circulating amino acids that your whole body uses. So we also have to be aware that there are these changes in what's circulating as well as metabolism when estrogen is going up and coming down, as same as progesterone. So progesterone in itself raises your internal temperature, so you might not be able to handle heat very well. We also know it breaks tissue down, so we have a little bit more issues recovering when we have that progesterone elevation in the high hormone phase. We have some changes in the way that our body stores carbohydrate or sugar. It reduces the way that our muscles store carbohydrate and put it more into the liver as well as into the endometrial tissue. There's some other aspects that progesterone also affect, but what I really want people to understand is that estrogen and progesterone are not just for reproductive function. They again affect every cell of the body. And as I go through this talk, I'm specifically discussing the natural menstrual cycle, because when we look at the hormone profile of an oral contraceptive pill or an IUD, a progestin-only pill, it's a completely different hormone consideration, and we'll get to that in another webinar. So when we talk about the high hormone phase, the goal of that high hormone phase or the luteal phase is to build tissue. So we know that with that onset of bleeding or the first few days of your period, you're shedding tissue. And the whole goal across that whole menstrual cycle after ovulation is you start to build in the endometrial lining in order to support a fertilized egg. If that doesn't happen, then you shed that lining again for your period. So the whole goal is to build tissue. And with that, your body uses more amino acids, so it needs more protein. Your resting metabolic rate, or the amount of calories you need just at rest, increases. You also have more of that carbohydrate storage within that lining instead of within the muscle. And we also know that we have an alteration in the way that our body handles carbohydrate and the way that it allows the muscle to activate and use carbohydrate. So again, we have to be aware of what's going on because these can directly affect how we adapt to training, how we recover, and how we feel about what we are accomplishing in our training and our fitness adaptations.
So Stacey, you've talked a bit about what's happening on the inside, and it's stuff that we potentially can't see. How can we use more obvious symptoms to understand our cycles?
Great question. I get this all the time, and it really starts with tracking. So we know that we can look at using our period as an ergogenic aid. If we know where we are in our cycle, then we can use these fluctuations of these hormones to benefit what we're trying to get out of with regards to training and with regards to recovery. So it's not that difficult to track. You can start by using a pen and paper or put in your training log, whatever works best for you. Just noting that the first day of bleeding is day 1, and then we have around day 13 or 14 is ovulation. And then we have this few days before your period starts again, where we start to have more of the premenstrual syndrome and more affect of what we're trying to accomplish within our training. So if you're tracking and you're writing down what your training is and how you're feeling, then this is a really fantastic start. If you really want to get into biohacking, meaning that you really want to understand what's going on and figure out how to definitively find out where you are in your phases without blood tests, you can look to use an over-the-counter ovulation predictor kit with your basal body temperature. Because after ovulation, your internal temperature goes up, because as I said, progesterone increases your temperature. So this is a way to really understand where you are in those phases without blood tests. So when we think about it, you can also go to the app aspect where you're like, wait, that's too hard. I don't want to do the whole biohacking, but maybe I can use some of these apps that are coming up. There's Your Woman, there's Flow. This one, Wild AI, I really like because it uses algorithm of artificial intelligence that was designed by women for women. So the more data that you put in about yourself, the more it learns and can feed back to you. So it takes some of the onerousness off tracking and trying to figure out what to do. So the basic idea behind tracking and why we want to understand is it comes down to what we call a general adaptation syndrome. So basically our body encounters a stress, it can hold on to that stress for a couple of weeks, then it really has to recover. So if we take this into a training scope and we see that, you know, first we have a day one or a week one, and we look, okay, we're in the follicular phase, and this is when we can hit it hard. Our body can really recover well because estrogen's low, progesterone's low. So yeah, it fits really well in a 4-week training schematic. So we can look and say, yeah, I'm doing the hard work where my body can handle the hard work, and then I'm backing off in week 4, right before my period starts. That's fantastic. That's how my body works. This is how I can adapt to training well. But what if you have a shorter cycle? So then you have a little bit less time available for hitting high intensities before your body starts going, wait, I can't really handle that stress so much. And then when you start looking at putting in some of that deload, which you normally would, your body's back into the, I can hit it hard again. But you wouldn't understand that unless you tracked your cycle. And then if you have a really long cycle, then you have almost 3.5 weeks where you can really hit it hard and be resilient to stress before you have to start thinking about deloading. So understanding how your cycle responds and how you respond within the different phases can really give you insight of how to actually structure your training or work with your coach to structure your training. So just giving that brief overview of how your hormones can really affect you, your training, your personality, from regards to how you feel about yourself and your training and adaptation. Just remember that most of the data out there that is prescribed for training and is prescribed for recovery is generalized for male data. And we know that women are not small men, which is why we are taking this chance to actually educate you and make you understand what's going on with your unique female physiology.
Thanks, Stacey. It's clear that normal is a fairly wide spectrum, but if you have seen something here today that makes you concerned about yourself, please make sure that you see your healthcare provider.